Welcome to Security Heroes, a podcast by Athena Security. We share real-life stories to help connect you to real heroes in the security world. I am your host, Lisa Falzone. Warning, the following recording contains potentially disturbing content. Listener discretion advised. So with us today is Dr. Ryan Oglesby, President of the Emergency Nurses Association. Ryan is a nurse leader with over a quarter century of experience in the emergency nursing field. As a board-certified emergency nurse, his career has run the gamut from stretcher side nurse to ICU staff nurse to flight nurse to emergency department nurse manager. As a nursing consultant and executive, he has led teams in healthcare transformation services and currently leads a team driving logistics center strategy for HCA Healthcare. And as an emergency nursing expert dedicated to maintaining safety in healthcare settings, we're glad to be able to talk with him today. Ryan, thank you so much for joining us. So, what is the biggest safety concern for emergency nurses?
Yeah, absolutely. Thanks for asking and thanks for having us. Workplace violence is one of the largest safety concerns for us in the emergency department, emergency care setting. It has certainly reached epidemic levels in many cases. And every time you turn on the news, you hear about a healthcare worker or an emergency care provider that's been assaulted. And so that's really one of our most significant safety concerns that we're advocating for at this point.
Awesome. How dangerous of a job is emergency nursing? I mean, I think a lot of people don't realize, I know it's in the news a lot, but I mean, at least for me, I didn't kind of realize like how violent it was. So yeah, any insights on that?
It certainly is. It's become very violent, unfortunately, and patients and family members acting out in a way that puts us in jeopardy and puts our safety in danger. ENA recently did a study of workplace violence and found that 56% of respondents had some type of emotional, verbal, or physical assault in the last 30 days. Since they had worked. And so it is really is a significant problem, as I said, not only in the sense of physical violence, but also verbal abuse, emotional abuse, all while trying to provide care for our patients and our communities.
So why do you think workplace violence is so prevalent in healthcare specifically?
I think its prevalence is twofold. One, we are meeting people at their worst most times, and whether it be the patient themselves or the family member, they're in a crisis themselves, and they're at their worst point. And then I think the other piece to that is, in a lot of ways, the tolerance for it has increased, unfortunately, and you hear a lot about, well, it's part of the job, or it's to be expected if you work in the emergency department. But our belief is no nurse should go to work scared or afraid, and no emergency care professional who's serving patients or serving their community should feel threatened in the line of their duties. And so we certainly support a zero tolerance stance on violence in the workplace, and certainly in the emergency department.
Have you personally ever had to deal with an unfolding workplace violence incident where you had to jump in personally or intervene?
Yeah, absolutely. I've worked in busy academic level trauma centers, and certainly have had many instances where I had to intervene, preventing patients from throwing computer terminals and monitors, and intervene when a fellow coworker was cornered in a room in a trauma bay at one point by an angry patient, and being assaulted and having to kind of remove them. And in a lot of ways, you put yourself in danger out of instinct and out of care for your colleague. But again, as I said before, we really shouldn't be put in those circumstances or those situations where escalated so much. And we certainly spend a lot of time and training on de-escalating and certainly helping patients in their darkest times, but oftentimes it certainly goes too far, and the preparation and the training that takes place, also doesn't exclude our need to advocate for this zero tolerance and not having it to be a part of the workplace that we go to every day.
What do you think? I mean, I know like patients are at their worst, but like what are they specifically upset about generally? Is it wait times? What is it?
Yeah, I think it could be a myriad of things. And again, sometimes it's patients, sometimes it's family members or loved ones that are with them, from wait times to not being satisfied with the treatment plan, not being satisfied with the care outcomes. Again, I think it's a multitude of factors that get people to a point where they turn to violence or aggression as their solution.
Is it like a diagnosis sometimes that they don't like, or is it that at all? Or
Yeah,
typically,
no, I typically don't think it's necessarily a diagnosis that they don't like. I think it can be I don't agree with the plan, or I wanted something different, or in some cases, again, with the wait times, it's I waited an extended period of time to find out, in fact, that there's not something that we can help them with. And I think a common misnomer in emergency care settings can be that we're not going to find everything. In other words, people can present to the emergency department, and have some expectations about, I really want to find out what's wrong with me. And we may not have all those answers. We're certainly going to stabilize patients, find out that you're okay and that you're not dying, you're not in danger, but you may in fact have to follow up with another provider for some ongoing testing and to find out exactly what it is that's going on. So sometimes, again, that can be frustrating for people as well.
yeah. What do you consider the key policies or technologies that hospitals should have in place to help preserve the safety of their patients and staff?
Yeah, I think from a key policy perspective is really a zero tolerance for violence and abuse, altogether. Certainly, we want to advocate that facilities have that in place. Again, I think the other piece that we advocate for is certainly that support after an incident has occurred, when they do occur, that emotional support for the nurse and the care team and follow up. Also, that advocacy for pressing charges against the assailant, for moving that case along. Again, we have in the majority of states in the U.S., we have felonies against violence against healthcare workers. We're certainly working to make that a federal
Mm.
ban, but we certainly advocate for facilities to have policies in place that have again, a no tolerance, but also a stringent kind of follow up when there is an incident that occurred.
What about technologies?
We don't advocate for any particular technologies. There certainly are a lot of technologies out there. We certainly partner with vendors, with our engagement council and other things, and certainly through our conferences, and to provide our members access to those type of technologies. We don't necessarily advocate for any. Again, I think it's more of a global approach to how we
Mm.
deal with violence before it occurs and how we deal with violence after it's occurred. And certainly our priority is also advocacy at the federal level and also at the state level to so that we can punish assailants up to the highest extent of the law.
So, as ENA president, I know you hope to continue to encourage more people to become emergency nurses. Do you have any particular initiatives in 2025 that you want to mention?
Yeah, I mean, we're very excited about our new 2025-2030 strategic plan, and that's certainly all about engaging people, as you said, bringing more people into the Emergency Nurses Association, as well as promoting kind of those core activities of education, support, advocacy, and networking that we provide. And that's kind of our priority to kind of move that forward in the coming years.
Yeah, so you said that safe and effective staffing is the biggest challenge facing emergency nursing. How much of an effect does safety and security have on staffing issues?
I think they are connected. I think certainly having the adequate staffing that's needed in the emergency department is going to help us with not only to de-escalate violent situations, but also to provide that support if an incident has occurred, or also to have other staff members and fellow colleagues to be engaged when there's a situation that may be turning high risk or putting people in danger.
Awesome. So in closing, if you had the power to make all hospitals in America do one thing, what would it be?
I think again, it's just that putting those policies for advocacy and support of the healthcare worker, putting that first and foremost would be the one thing that I would say that, we really all should be committed to, that zero tolerance on violence and committing for advocacy to make the emergency care setting a safe place for everyone to work. And we've done a lot of work partnering with our physician colleagues at the American College of Emergency Physicians as well. The No Silence on ED Violence campaign has really been an important aspect for us, again, to bring that to the awareness of hospital leaders, of local community leaders, the community as a whole. So again, it's really that advocacy and putting that support out there for all emergency care workers.
Awesome. Well, thank you so much. Anything else you wanted to add?
Yeah, no, thanks. Thanks for having me. I think that's a great discussion, and I'm glad that you're interested in the topic and wanting to help us advocate in that way.
Yeah, that'd be great. And yeah, thank you so much for the opportunity. I was really excited to interview you. So thank you so much.
Good. I'm glad to do it. Thank you. See you soon.
Bye. Bye. Security Heroes is brought to you by Athena Security. To find out more about Athena Security and how we help save lives through our weapon detection solution, visit www.athena-security.com. And then make sure to search for Security Heroes in Apple Podcasts, Spotify, and Google Podcasts, or anywhere else podcasts are found. Make sure to click subscribe so you don't miss any future episodes. On behalf of the team here at Athena, thanks for listening.